Funding for the Maddy Report is made possible by grants from the California Emerging Technology Fund, leaders in the quest for digital equity. The James Irvine Foundation, committed to a California where all low-income workers have the power to advance economically. Fresno State Associated Students, Inc., students serving students. BNSF Railway, moving our economy for 160 years. And The Wonderful Company. The Maddy Report is also made possible thanks to contributions from Harris Ranch Inn and Restaurant and E&J Gallo Winery. From the Maddy Institute, the Public Policy Institute for the Valley's 4 public universities, this is the Maddy Report with Executive Director of the Maddy Institute, Mark Keppler.
Welcome. California is home to 10.6 million immigrants, 80% of whom are naturalized citizens or legal permanent residents. That leaves 2 million to 2.6 million undocumented immigrants. Those are people who either enter the country without authorization or here despite having an expired visa. Those undocumented immigrants, of course, get sick. However, unlike the rest of us, they have limited access to the safety net programs. What does this mean for their health and, frankly, the health of communities where they live? Our guests are Paulette and Shannon McConville, research fellows with the non-partisan Public Policy Institute of California. Welcome to the Maddy Report.
Hi, thanks so much for having us.
So you guys have studied healthcare access, utilization, outcomes, et cetera. Shannon, I want to ask you first. The recent pandemic really underscored, how one person impacts the health of people in the community. And just given their lack of access to healthcare and health insurance, I'm just wondering, how did that affect the undocumented immigrants in particular?
Yeah, Mark. Well, a global pandemic really does remind us of the importance of public health and how our own health and well-being is really connected to the other people in our families and in our communities. As you mentioned, and as we'll discuss a little bit later, undocumented immigrants do have much higher uninsured rates, which does make it more challenging for them to access healthcare when they need it. There's also less contact and engagement with the broader healthcare system. And so because they don't have these connections, they may be more hesitant or less likely to go to the doctor or go receive care. And again, when we're in the midst of a pandemic, we really do need everyone to be able to be tested and treated if they do get sick.
So Shannon, what's been the government's response to this?
Right. Well, when the pandemic started, actually, the federal government really did step up and create a lot of large relief programs. One of those did provide funding, so federal funding, in order to pay for treatment and care provided to anyone who was uninsured, regardless of their immigration status, if they did in fact become ill with COVID. So, in many ways, that was in order to protect those healthcare providers and our hospitals and healthcare systems so that, broadly speaking, they could provide needed medical care to anyone who showed up at the door and may have been infected.
Yeah, I want to ask Paulette, in your report, you looked at something called the California Health Interview Survey. And I'm just wondering, what is that exactly? And what are some of the key patterns that you noticed when you looked at undocumented immigrants in California?
Sure. So the California Health Interview Survey is a representative survey of Californians. It's fielded, it's actually continuously fielded, and they have data releases every year by UCLA. And it is great because in addition to collecting lots of information about health insurance coverage, health conditions, and health behaviors, it also asks questions about income and demographics, including immigration status. So it is a really great tool for the kind of analysis that we wanted to do, which was to examine the healthcare utilization and health outcomes for undocumented immigrants. So some of the findings that we had in the report included the fact that and I should mention that we really focused on low-income undocumented immigrants, and that's because these are the individuals who are likely to face the greatest barriers to care. But that's not just a tiny sliver. It's about 70% of undocumented immigrants that we would consider low-income in California. We found that rates of health insurance coverage were substantially lower for this group, somewhere around 45% as compared to US-born Californians or immigrants who had naturalized U.S. citizenship or who have green cards, and they're all uninsured at rates around 10 to 11%. So it's a really big difference in terms of their health insurance coverage rates. And unsurprisingly, that does also translate to differences in access. So in terms of being able to identify a usual source of care, to be able to point to a place where they would go if they get sick and need to see a doctor or a nurse, so we had much lower levels of being able to identify a usual source of care among low-income and undocumented immigrants as compared to other types of immigrants who would be, green card holders or U.S. citizens who had naturalized. They have higher rates of missing out on healthcare due to cost or lack of insurance. And so that's not terribly surprising given the insurance coverage findings that I mentioned earlier. But it really does kind of point to the fact that this group within California is underserved and does have ongoing need for access to care.
Yeah, so this data I would assume is pretty hard to find for these folks. And how do you distinguish between? And we only got about 15 seconds, but real quickly, between low income and high income, and between those who are entirely undocumented versus mixed family. I mean, was that all broken down in the data?
So it is largely broken down in the California Health Interview Survey. So the income is super easy in the sense that we just use a cut point of 200% of federal poverty to be, where we draw the line between low income and non-low income, and that's consistent with other PPIC research. And then in terms of identifying likely undocumented survey participants, we actually use the data they collect on their immigration background and current status. And we use the proxy of being a non-green card holding immigrant and a non-U.S. citizen immigrant.
So you get the data to be able to analyze and get the results that you need to be looking at. Well, up next, we're going to talk a little bit more about undocumented status and what that means for healthcare. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. The lack of health insurance among undocumented immigrants has long been a policy concern. The public generally assumes that it results in higher medical costs for everyone, since they may not engage in preventative medicine, or they may rely on the emergency room for access for their healthcare issues, usually at the point, of course, where it's a medical crisis. We're talking with Shannon McConville and Paulette, experts in healthcare access with the non-partisan Public Policy Institute of California, who recently wrote a report entitled Health Coverage and Care for Undocumented Immigrants in California. So, Paulette, I want to ask you a question. You cite several pretty interesting statistics in your report. Key is that undocumented immigrants lack health insurance at much higher rates than documented immigrants or U.S.-born citizens. So what are some of the barriers that are to obtaining health insurance that undocumented immigrants are experiencing compared to, say, legal permanent residents or citizens?
Sure, that's a great question. So since our report focuses on low-income undocumented immigrants, I'll mostly be talking about eligibility for Medi-Cal, which is, of course, our state's program for low-income residents. And so for Medi-Cal, lack of eligibility is a really big reason for low insured rates among undocumented immigrants. There are certain age groups that the state covers using mostly state funds to allow undocumented immigrants to enroll in Medi-Cal. But the largest group of undocumented immigrants, which is kind of this working age range, continues to be ineligible for the time being. Private insurance is actually a possibility, but if undocumented immigrants are not able to access employer-provided health insurance, it can be hard to buy on the individual market. And further, they are also barred from purchasing insurance on the exchange as individuals.
I'm just wondering, so for adults that are undocumented, what kind of health insurance coverage can they get?
They can buy individual private coverage. They can get employer-supplied private coverage. Certain age groups can get Medi-Cal. Medi-Cal is also available for medical emergencies or for certain conditions, although it's not really what we consider full scope health insurance. And even those who are eligible for Medi-Cal may not realize it because the eligibility criteria can be quite complex.
It's a Byzantine structure. Let me ask you this, Paulette. What about older undocumented? I would assume they have more serious healthcare concerns. What's the issue there?
So I would say that for sure, if older undocumented immigrants have had a lot of years or perhaps even a lifetime of avoiding care due to lack of access, then there may be underlying undiagnosed conditions that we would only learn about when things get a little bit more advanced and are bigger concerns. Undocumented immigrants are aging. Of course, older individuals have greater healthcare needs. And so when older undocumented immigrants remain uninsured, that is certainly a concern for their ability to address their healthcare needs.
Well, let me ask Shannon, what about children and young adults of undocumented family members? What's their healthcare status?
Right. Well, as Paulette mentioned, so undocumented children and young adults, so anyone under the age of 26 is actually, if they're income eligible for the Medi-Cal program, they can get full scope benefits, kind of regardless of their immigration status. But this is a relatively small group of undocumented immigrants in our state, and it's a relatively inexpensive group to cover because the younger you are, the healthier you tend to be. But they do have broader access in terms of being able to access public coverage options, which may not mean that they always use that coverage or sign up for it, but it is at least available to them.
Yeah, you mentioned that undocumented immigrants often avoid federally, in your report, federally subsidized programs altogether for fear of deportation. So I'm wondering, how has the federal government's actions impacted the lack of health insurance coverage among undocumented immigrants?
Yeah, there have always been concerns about amongst the immigrant community as to whether using safety net benefits like public health insurance or nutrition or cash assistance could impact a person's immigration status, especially if there was something such as, federal immigration reform or comprehensive immigration reform. People are concerned it might impact their ability to normalize their status. These conversations are often referred to as public charge. So will you be a public charge? Under the Trump administration, there were some changes, or he had proposed some changes to those rules that were going to make them more strict. And I think, by most evidence, they did have a chilling effect. So fewer undocumented immigrants did access services. I will say that those rules have been reversed and now under the Biden administration. And so now they've at least clarified that using public health insurance should not impact your immigration status or your ability to normalize your.
I would guess so. There's still some trepidation among that population because, things change, but they're still thinking, could change back yet again. So when we come back, we're going to continue this discussion on undocumented immigrants and their access to healthcare. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. Because of the low rates of health insurance coverage, many undocumented immigrants have to rely on less than comprehensive safety net access to even basic medical care. We're talking with Shannon McConville and Paulette Cha, the research fellows at the Non-Partisan Public Policy Institute of California. Shannon, I want to ask you, you hear about this healthcare safety net. I'm wondering, who are those healthcare safety net providers for undocumented adults, and how exactly do they serve those individuals?
Right. So the healthcare safety net really is this patchwork of different types of providers and some really small programs. Community health centers and primary care clinics are some of the main places that people who don't have insurance coverage, who may not be able to pay for services that they might need, and or who have immigration status issues, safety net providers tend to serve everyone regardless of any of those things. So community health centers, clinics provide a lot of outpatient care. Public hospital systems in the counties that operate them also are a key provider, as are hospital emergency departments, which under federal law, again, have to treat people who seek care for any medically necessary treatments.
This is kind of interesting. And I was reading your report, I found something that I was frankly really surprised about. And that was, I always assume that undocumented immigrants have to use the emergency room if they have a medical problem. And so you're thinking, well, that implies that they're really not engaging in preventative care. So, they're not taking the blood pressure medication to stop them from having a heart attack or something. But what did you find? I don't think you found quite what a lot of people assume when it comes to undocumented immigrants and the emergency room.
That's right. We did look specifically at ED use. And again, as we've mentioned, this is amongst immigrants, both undocumented immigrants as well as other low-income permanently residing immigrants. And we really didn't find any differences between those two groups in terms of how they use emergency departments. So we looked at whether they had any ED visits over the course of the year, how many ED visits, and there were no differences across this group.
I was saying ER, but ED and ER are ER
emergency room is still a very common way to do it. I do a fair amount of work on emergency rooms or emergency departments, and because they have grown both in size and kind of responsibility, we do tend to have shifted to the emergency department.
Yes. Okay. I'm a little behind the curve, which is
right.
frankly not unusual. But I thought was really interesting in your report. You were saying that only a small percentage, less than 3% of low-income immigrants report the emergency department as their usual source of care. That frankly surprised me.
No, it's true. I mean, across most groups, there is this idea that maybe people do, all I have is the ED. That's the only place I know to go. And generally, that's just doesn't seem to be true. Most of the immigrants, regardless of their documentation status, but including undocumented immigrants, report that, say, a primary care clinic or another public provider is their usual source of care.
Yeah, you talk about these county indigent programs. Can you explain what those are?
Sure. State law actually requires that counties be what we call providers of last resort. So they're required to provide healthcare for those that are deemed medically indigent. I will say that counties have a pretty wide latitude in determining who meets their indigent standards. And so in some counties, they choose to serve people who are undocumented immigrants, and in other counties, that is a restriction. And so undocumented immigrants are not eligible for county indigent care programs. One of the Los Angeles County has a large number of undocumented immigrants, and they run a program called My Health LA that primarily serves low-income undocumented immigrants, and we include some information in our report on that.
Yeah, Paul, I want to ask you, what kind of healthcare data do you have on undocumented immigrants? I'm just wondering, does it give an adequate or accurate picture of healthcare for that group?
In terms of individual health status, that's a really tough one. So I would say that there are a couple of categories of data when we're talking about the health of undocumented immigrants or likely undocumented immigrants, because often we are proxying and guessing and doing our best to identify these individuals. So sometimes you'll have data where you can actually make pretty strong guesses about who's undocumented. And so that's like in the California Health Interview Survey that we used in our report. There are also methods for using the large American Community Survey to identify likely undocumented. But because in surveys, health status is self-reported, often people who are not getting healthcare don't always know that they have underlying conditions. And so that's really tough. And I think that the next step is to try to get data from these safety net providers that Shannon discussed to identify what's really going on with the health status of likely undocumented immigrants.
Yeah, that's really an excellent point. When we come back, we're going to talk a little bit more about addressing the healthcare access of the undocumented living in California. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. COVID demonstrated how vulnerable undocumented residents are and how when they have a problem, it really impacts the entire community. As the pandemic recedes, policymakers are asking themselves how we should handle this problem and future problems when it comes to healthcare for the undocumented. Our guests are Shannon McConville and Paulette with the non-partisan Public Policy Institute of California. So Paulette, I want to ask you, can you summarize kind of what the state has done in terms of legislation in the past few years to expand coverage for the undocumented immigrants? Are these proposals likely to, you're going to see more of them in the future? Just wondering, and then what role does private insurance play in all this?
Absolutely. So I would say that of course, our study focuses on low-income undocumented immigrants. So I will talk mostly about the Medi-Cal expansions, which are the really big policy changes that California has taken to increase coverage for this group. So in 2016, California expanded Medi-Cal to all income eligible children. And I think that was in May 2016. Following that in 2020, they expanded further to young adults up to age 26. That one kind of got lost because, they
keep closing the gap, right? They keep,
That's
right.
That's right. So they're kind of adding in these different age groups. And then most recently, seniors became out. I shouldn't say seniors. Ages 50 and older became eligible.
Yes. I appreciate you saying that, Paulette.
I said seniors because previously there were older ages in discussion, and I think through a series of negotiations between the legislature and the governor's office, they did arrive at a younger threshold. And so that most recent expansion of Medi-Cal eligibility was for adults ages 50 and older. And then coming in 2024, that will be opened up to the largest remaining group of uninsured, which is these kind of working age undocumented immigrants, ages 26 to 49, the kind of biggest uncovered group so far.
And you can see the state's kind of chipping away at these various groups to kind of fill the gaps. I'm just wondering, the state's taking a lot of action here, but what about counties? or the federal government? Is the state, can the state do anything to kind of encourage them to get more involved in this, in increasing coverage?
So I think counties is an interesting question. I think certainly the safety net providers that Shannon spoke about previously could they're already serving large proportions of the undocumented community, and so targeting resources to those providers is one way to continue to incentivize healthcare services for this group. Previously, we had been talking in California about getting a federal waiver to allow undocumented immigrants to purchase private health insurance on the exchange, which of course has covered California. That is something that I think advocates are starting to raise again now that we are in a new presidential administration. So that is certainly a potential avenue for getting access to private health insurance. And I think that, beyond the pandemic, continuing to engage with trusted messengers, with CBOs about ongoing public health efforts, vaccination, other, things that affect all Californians by, speaking to undocumented immigrants with limited access to care will continue to be a really good strategy that we've learned during the pandemic.
Yeah, Shannon, I want to ask you, it seems like California's really tried to expand healthcare coverage for these low-income immigrants, regardless of status. The question is, is anybody going to be following California's lead here? Is the federal government going to follow it? What about other states? And is it going to result in increased costs for healthcare because more people are accessing the healthcare system, or lower costs because more people are going to be involved in preventive care, taking the blood pressure medication instead of having a heart attack? I mean, how does that work out?
Right. So I do think other states will be watching California in our experience. I will say we weren't the first state to expand, say, Medi-Cal eligibility to children. We will be the first state in the country to, once the expansion goes to all adults, as Paulette mentioned, in 2024, we will be the first state. And then I do think people will be watching to see what that experience is. As for the cost question, I don't think we have enough information. There's still some unknowns there. On the one hand, undocumented immigrants have higher labor force participation rates. They're very connected to work, suggesting that they, may be relatively healthy, although and Paulette's mentioned this, they may not access care when they need it. They may not know if they have certain health conditions that do require treatments. And so, I think it is an open question as to how this will evolve. One of the places where hopefully we can get some more information and learn from will be the expansions that we just did to that group.
I think and by the way, I'm sorry to cut you off. We're running up against the clock here, but yeah, I think that, and also Republicans, conservatives to say, are we creating an incentive for people, to come here by giving these services? That's a whole other issue, a whole other discussion. But I want to thank you for being here, Shannon McConville and Paulette Cha from the Public Policy Institute of California. This is Mark Keppler for the Maddy Institute. Thanks for joining us. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.org.